I always talk about what we do in pediatric plastic surgery as life-changing rather than life-saving. So the great thing about working with kids is we have a big impact on their longevity and their quality of life over time. I'm Noopur Gangopadhyay, one of the pediatric plastic and reconstructive surgeons at Ann and Robert H. Lurie Children's Hospital of Chicago. So as a plastic and reconstructive surgeon, I get to operate all over the body. So some days we are removing skin cancers or moles that might be concerning for skin cancers on the head and neck region or on the extremities. Sometimes I'm borrowing muscle from the thigh to recreate a child's smile, or I'm using the tissue that was already there to reconstruct a cleft lip and cleft palate. So we aren't limited by a particular anatomical area or by a particular type of tissue. We're able to operate with all of those tissues to help people breathe better, look better, and feel better. So I think sometimes the best outcome possible is really also set with expectations. So I try to give the parents and the patient reasonable expectations about what surgery will look like, what the postoperative follow-up will look like, and what they should expect in terms of the long-term visits. I try to speak to them in layperson's language to try to explain things that are complex in a way that they can understand and easily digest. I also think it's really important to get the patient's opinion on things. So we don't just operate in isolation because the parent tells us to. So I like to get the patient's ideas on what surgery is going to mean for them in terms of their day-to-day, in terms of school, in terms of friends, and how they explain themselves at school and sports. The nice thing is we have a lifelong relationship with these patients and with their families. And so you may see them as small babies, less than a year old, and then we see them at their college graduation as well. And so that long-term relationship is really rewarding and probably the best part about working in pediatrics.